Cristina Guevara joins me to discuss the impact of coronavirus on Latin America. She's a program assistant with the Atlantic Council. Her focus on Latin America development and policy, and she joins us from Panama City, Panama. Cristina, I know you're in Panama City. I'm going to get to Panama in a moment, but I really want to start with Brazil. The hardest hit country in Latin America, the second highest death toll from the coronavirus than any other place in the world after the United States. Where did Brazil go wrong, and how much does President Jair Bolsonaro is to be blamed for this?
Thank you so much for having me. Yes, as you mentioned correctly, Brazil currently stands as the second country with the most COVID-19 deaths, and the president has been highly criticized for his response. What we're also seeing in Brazil is that each state is sort of going on their own path in the middle of a lack of federal unity. However, despite these gloomy indicators, we have also seen that stimulus packages in Brazil have helped as well. So we have yet to see what the next year will bring regarding coronavirus in Brazil.
Okay, but I'm still trying to really get to the bottom of what went wrong in Brazil.
Well, as you know, we have seen a lack of leadership at the presidential level, and that has really worsened the health crisis. I was talking a little bit about the stimulus packages. Those have been applauded for relieving poverty, but at the same time, it will worsen the country's fiscal debt. So just all around a very complex situation, and we just hope that a vaccine can get approved and distributed for all Brazilians in the near future.
So another country that has done much better than Brazil is Uruguay, a success story in Latin America, but cases there have started to go up. What did Uruguay do right?
Yes, as you mentioned, Uruguay has successfully kept the spread of the virus contained at first, thanks to its lockdown measures, a small population, low population density, and swift and efficient testing. But now Uruguay finds itself in the middle of a recent increase in new daily cases and fatalities. So it will be critical to maintain those testing rates, contact tracing, and limiting exposure to keep the virus under control. The government has already announced new measures, and those include closing its borders from December 21st to January 10th, except for cargo.
And finally, you're in Panama, where officials have reimposed restrictions, which I think it's interesting. Most people may not know this. The restrictions require men and women to carry out their holiday shopping on different days. Is that making a difference? And I know they did this also back in June.
Definitely. Well, Panama has been very hardly hit by the virus, both economically and health-wise. In fact, the Economic Commission for Latin America and the Caribbean's latest projections for the country point to an 11% GDP contraction. So the government is doing what it can to try to keep the economy open while implementing certain measures that will alleviate the health crisis, as hospitals are just drowning right now. So good news is that the Pfizer vaccine was approved for emergency use in Panama and is expected to arrive around February. So at least we have those good news to look forward to.